Welcome to today's event. And the title of this event is COVID-19, Social Impact, Policy Responses, and the Roles of Experts. I am pleased to welcome our two speakers for today's events. Dr. Philippa Whitford has already joined us here. She is a member of the British Parliament and is the Scottish National Party's spokesperson for Health and Europe. And Professor Lothar Wieler is going to join us shortly. He is the president of the Robert-Koch-Institute, the German federal government agency and research institute that is responsible for disease control and prevention. Thank you for being here today. This event will be chaired by Professor Klaus Hurelmann, Professor of Public Health and Education at the Hertie School of Governance. We are looking forward to a lively discussion and questions from the audience in the Q&A section, some of which will be posed at the end of the discussion. Dear Professor Hurelmann, over to you.
Thank you. Well, I'm working here at Hertie School. It's in Berlin. It's a University of Governance. And actually, my fields are public health and education. And I'm especially interested in developments of children and adolescents. And recently, of course, the focus of my research is on the development of children and adolescents and young adults in the area of the pandemic. How do they react to communication? What are their problems with judging information, applying information to their own situation? So all this is in the forefront of my interest. And what we do already see is that the bulk of information, the overabundance of information is really a problem. And this will be in the center of our discussion. How can people deal with information coming from science? How can the audience, the public deal with it? But mainly, how can politicians deal with it? How do they know what is really solid and evidence-based scientific research results and what not? And therefore, I'm very happy that we do have a politician on our podium right now. Thank you for coming, Philippa Whitford. You are medical doctor by training, a breast surgeon. You have lots of international experience, I have learned from your vita. You are a strong supporter of the National Health Service in your country, which really is a very special feature of the British system, mainly a liberal market system in its character. The National Health Service is a public health system per se, and I know that you are fearing that this system might dwindle, might be at risk. I have seen a citation from you. You warn that there is a creeping privatization of the NHS. Thank you for being here. You are very good expert in this area, and right now you are working for the Scottish National Party as the shadow secretary, not only for health and social care, but also for European positions and European problems. Well, we are still waiting for Professor Wieler. So the original idea was that he starts from his more scientific and administrative positions, but we just switch around. And I would ask you, Philippa Whitford, to start with your presentation from your perspective as a politician. How does all this really run into your business, and what did you learn from it? Please start your remarks at the beginning.
Thank you very much, Professor. I mean, I think we all have to recognize that at this time last year, there was no handbook on COVID. We were literally dealing with a totally new viral disease, and therefore governments right across the world were largely unprepared, even though the threat of a pandemic is something that had been discussed and was on many national risk registers really since the 2009 avian flu. But they were not actively prepared. And what we saw was many governments struggling in the first wave and in those first months. I think in the UK, one of the issues that we've had is the false dichotomy between the economy and public health. And the government has had a tendency to move backwards and forwards between the two. So when the cases surge, when the hospitals are overwhelmed, when deaths rise, suddenly we have a lockdown. It's the public health crisis that is the focus. And then we move back that it's getting the economy going, that is the imperative. And so we saw that last summer. We had people encouraged to go out into restaurants. They could get money off vouchers. People were encouraged to go on holiday. Then we ended up in another wave. And this really is a false dichotomy. If we look at the countries that really strictly managed their borders and drove down community spread to what's called elimination levels, then they actually have their domestic economies fully open. We see that with the Australian tennis championship at the moment. We see it in New Zealand, Singapore, Taiwan, where people are out and about in a very normal way, but have to accept they can't go on international holidays, or they will have to accept very strict quarantine on their return. And many of us feel that that would actually be quite a sensible trade-off. And here in the UK, the London School of Hygiene and Tropical Medicine, many key figures there have recommended, and indeed are recommending again this week, this kind of zero COVID or elimination approach. I think an important point from the social aspect of COVID is at the beginning, some people were saying COVID is a great leveler. Everyone could catch COVID. But actually, we've seen over the course of the pandemic, that's absolutely not true. So professionals like myself who can work from home, have meetings through Zoom, we are much less exposed than someone who is a key worker, whether in a supermarket, on a transport system, or in a care home. And so they have a much higher risk of catching it. And often because ill health is associated with deprivation, people who are paid less or living in poverty will actually suffer a much greater and much more serious illness in relation to COVID. And we've also seen that obviously with Black and Asian minority groups suffering a much higher and much more serious illness. The other thing is the spread within such communities, in that people who are low paid or in insecure work, even if they test positive, or they are contacted by the tracing system, are often quite reluctant to isolate because they might have no income at all. And it took until September before in the UK they introduced an isolation payment of £500 to cover the 14 days. The problem is that's way below minimum wage. And if you look at the data from local authorities, between 50 and 75% of people who've applied have been refused. So it's not surprising to find in research surveys that in the UK, only 30% of people asked to isolate actually do so. Now that's what your testing and tracing is leading to. So if you can't, if people aren't isolating, no amount of testing or tracing is going to stop the viral spread. So isolation is absolutely central and absolutely critical to fighting viral spread.
Dr. Whitford, I'm very sorry to interrupt. We are having some severe technical difficulties. My team is setting up a new Zoom call right now, and I would like to ask you if that is okay to finish your opening statement, and then you will find a new link in your email to join a new Zoom call with Professor Wieler. I'm very sorry for that.
If people are not hearing me, do you want me to join the new Zoom call now?
They are hearing you, they are on Facebook, but we will set up this new Zoom call for people to be able to join the Zoom call directly, as well as Professor Wieler to join the Zoom call. I'm very sorry for that.
But you still want me to continue with my presentation?
Yes.
Right,
yes.
okay.
They do hear you on Facebook.
Right, okay.
Yes.
So obviously it is absolutely critical that people with insecure work, low paid work are supported generously, so they isolate, because that's actually for the benefit of all of the rest of it. You referred, Professor, to the dialogue between scientists and research and politicians. You know, in actual fact, if you look in the Westminster Parliament, it's less than about 30 MPs either have a medical or scientific background. And I think that is, you know, that's one of the strengths of the Chancellor Merkel, that she has a science background. I think it's one of the weaknesses within our parliament that we have so few members of parliament who have that scientific education. Because trying to understand the research as it becomes available and committing to that research and acting on that research is quite important. So the phrase "following the science" has been quite central in the UK's response, but often we found that advice was ignored. So the UK went into lockdown quite late on in March. England particularly came out very quickly in the summer. And in the September, when the second wave started, the advisory group advised on the 21st of September that we were starting to see a second wave and that the UK needed at least a short lockdown to try and stop the rising cases that we were seeing. Now, Prime Minister Johnson didn't take that advice and didn't lock down for another 6 weeks. In Scotland, our First Minister barred kind of household visiting from the very next day. But in Scotland, we don't have power over our borders, and we didn't have any power and still don't have power over the finances, with no borrowing powers at all. And therefore, that made it very difficult, as in Wales and Northern Ireland, to actually lock people down when we couldn't give them financial support. And the Chancellor in the UK didn't actually extend the furlough system, which was financial support for workers who couldn't work, until London went into strict COVID regulations, not when Scotland, Wales and Northern Ireland were in that situation. And that's one of the issues that we have. Obviously, you will have variation in Germany because health is also devolved to the lender. But equally, you're not left in a position of trying to manage COVID without actually having the powers. And the last thing I want to touch on as a theme is trust. Now, we had key figures, we had politicians who broke the rules, who traveled when they shouldn't travel, who visited people when they shouldn't have done. We had the Prime Minister's advisor, Dominic Cummings, obviously, and his famous trip. And also the sort of confusion around what is the advice, what should I be doing? And we are asking people to do really difficult things in this pandemic. We're asking them to not go to work. We're asking them to not visit their loved ones. We might be asking them to literally stay in a flat or a house all on their own for weeks and weeks and weeks. And people need to trust the leadership to do that. And I think when that trust starts to break down, then people don't follow the rules. And the other thing is that what you then see is you start to have this space within social media, within the internet, for people who are against lockdowns, who are campaigning against the use of face coverings, who are undermining the potential of vaccines. And therefore, you're leaving a space for that kind of narrative to be happening. And trust, I would say, is really one of the most important things. And I think contracts that have gone to party donors or friends of government being promoted, all of those things undermine that series of trust. Now, in the UK, we're in lockdown, as indeed many parts of Europe are. We're going forward with the vaccination programme, and obviously that is happening actually quite quickly within the UK. But we are already getting a narrative as if the vaccine is a magic wand, and therefore, once the most vulnerable groups are vaccinated, suddenly everything will be back to normal. So the Prime Minister has said today he will make an announcement at the end of this month about people booking summer holidays, international summer holidays. And the problem is, I fear that we're actually just going to go round exactly the same cycle again, and without the recognition that if you are allowing viral spread and replication, then you have more risk of mutations and variations. And if we do not work as a planet together, as a global community, to make sure all nations have the chance to vaccinate people, then you're simply not going to be able to travel elsewhere in the world without the risk of bringing a new and dangerous variation back. So there was a lot of good language last year about a global response to a global crisis. But with over 100 million cases and over 2 million people dead, what we actually see is kind of vaccine nationalism and people focusing again internally on their own countries. And I think that's a very sad thing and something that all of us need to campaign to change. Thank you. I wonder if we should just follow Isolde's advice and we leave this and come in on the new Zoom link, and then we can take that discussion further.
Thank you very much. I'm very sorry for this interruption. The
technology.
Thank you so much. Okay.
See you in a minute.
Yes, see you in a minute. Thanks.
You are the head and the president of the Federal Government Agency and Research Institute, Robert-Koch-Institute, responsible for disease control and prevention. And your institute now is in the center, of course, of the whole debate. How does politics and research interact? You mainly are on the research side, but at the same time, you are the chief translator of research results into the political area. And I'm very happy that you could join us and give us a short introduction into your thoughts about this topic. How did COVID-19 change our societal structures, and especially the cooperation between science and politics? And what are we looking? What kind of development are we looking for in the future? Please.
Yeah, thanks again for having me. It's an honor for me to be on this medium here, and I have to say that I enjoy these conversations so much because I learn so much. So I thought I start with the German response to COVID-19, and then we I guess we go to a more international level. So basically, yes, I'm the president of the Robert-Koch-Institute. That is Germany's public health institute, and I would compare it with Public Health England, basically, in our function. And we are good friends, by the way. All the national public health institutes are joining together in a so-called International Association of National Public Health Institutes, and that's why we all know each other, more than 100 national public health institutes, and we support each other, and we are in constant contact to manage, among others, this particular crisis. So I'm advising actually the German government to better understand the pandemic, and most important, of course, to develop effective interventions to prevent transmission and liaise with partners from all sectors of society. What is very important, and has already been mentioned by you, Dr. Whitford, we are federal states in Germany, 16 federal states, and on a legal ground, each and every measure in medicine is under the authority of each and every single federal state. So the national state doesn't have any impact on what is actually being done in each of the federal states, but we're only coordinating. The Robert-Koch-Institute is a governmental institution, and basically we only coordinate, and we only do operative work if we are particularly asked to do so and have only limited capacity to do so. So basically, the world changed a lot, and this holds true for each of you who is on the phone or on Zoom right now. And I think what this pandemic has brought one thing home, and more than any other issue, it is that we are in this together. And this is something that in the beginning was very strong solidarity. I've never seen in my life so far experienced such a huge amount of intense solidarity, but this is waning, I have to say now. In spring, solidarity was huge. And now, although it's all clear to everybody that health threats do not stop at borders, and that health protection is a global challenge, latestly with the upcoming of vaccinations as a tool that brings us out of this pandemic, this solidarity actually starts to get broken. I'm absolutely with you, Dr. Whitford, in this analysis. So we've been hailed for our response to the pandemic in the beginning, but I have to say now we're not doing good anymore. We have so many, the number of diseases is much too high. The number of deaths is more than 50,000 already. This is devastating, and I'm absolutely frustrated about this because we could have prevented this more intensively. And I'm also with Dr. Whitford to mention that the measures should have been taken in autumn more seriously, while in Germany the politicians did decide to enforce measures. They didn't enforce them strong enough. And so this is something that clearly was a wrong decision. And I have to say that this decision was made by the Minister-President of the Federal States. And we all wished, in particular, Chancellor Merkel wished that we would have put in place stronger measures. But as we are federal states, it's basically in the authority and responsibility of the lender. So in the beginning, we were very quick. The reason for this is, and this is one of the topics I want to talk about, science. Science is pretty strong in our country when it comes to science in infectious diseases. And we are lucky and happy to have a particular strong scientist working group on coronaviruses. And this group was involved in setting up the first diagnostic tool, and we're still all profiting from this. This is a PCR tool. It has been set up together with Christan Drosten, together with other people worldwide. So we had a very early diagnostic tests available, and the disease itself only came pretty late at the end of February. So we had enough time to prepare when it comes to ramping up diagnostics. In the beginning, this was a problem in many other countries. So we had very much diagnostic possibilities, not enough, but still reasonably enough. But we didn't have protective equipment. And this was a shortage that is based on very clearly, this is something that no country has been prepared for, at least in the Western part of this world. And so what I want to say here is that Germany has been very successful in the beginning because scientific evidence has guided political decisions. And I see here, and Dr. Whitford, you mentioned it already, here I see a difference, at least in some parts of the reaction between our two countries. And still, and ongoing, so at least so far, scientific evidence is guiding the enforcement of particular measures in Germany. So currently, the scientific evidence falls on fertile ground. However, we've seen a fatigue population now, and as the lockdown, as they call it, it's not a true lockdown, but it's some measures trying to reduce contacts, is running now for 3 months. Of course, people are fatigued, and I don't know how long we can hold this. And of course, not only the political, but the economic outcomes, and in particular, the inequality with particular people not being able to protect themselves and people losing basically their economic basis. This is something that we're seeing, that people are losing confidence. And we set up in March already, together with some partners outside, questionnaires so that we have a survey. In the beginning, we did this survey every week, and now we do it every second week to see how the population reacts in Germany. And we're clearly seeing that 60% of the people are interested in science, but now this is diminishing. This number is diminishing. Something that we wanted to talk about here is how do we as scientists communicate with the public? And I think this is a key issue here. How do we communicate? And here we have a clear disadvantage when it comes to a pluralistic democratic society. Obviously, everybody can exchange and give his or her views regardless of the qualification, of the expertise that is taken up by the media. And so you have a plethora of different opinions, which is good in terms of a scientific development, but which makes it very hard for the population to trust and to rely on particular contents and particular evidence. And this is something that is really basically a subject that leading to resistance and pushback in the delivery of scientific messages over the last month, I have to say. People getting frustrated, and I understand that people are making massive sacrifices, struggling with confinement or fear for their livelihoods. So still we don't have riots, which are directed towards those who are perceived as being responsible, but actually the aggressiveness, the fatigue, and also I would say the frustration is growing in German populations and citizens who haven't had much exposure to the virus. They of course perceive the current measures as too draconian and might be tempted not to comply. And so we are here at an issue which was again already mentioned by Dr. Whitford, compliance. In our societies, this is something that I'm seeing. I don't have really, this is not evidence-based. I don't have clear scientific data to show this apart from surveys, but it's clear that in some other countries, particularly in countries in the eastern part of this world, compliance to the measures is higher. And the bottom line of this pandemic management is quarantine. Quarantine means that people who are contacts and may be infectious stay in quarantine for 10 days or 2 weeks. At least they stay in their house, they stay in their place so that they do not infect others. And isolation, which means that people who are actually infected, who have been diagnosed as being positive, also stay at home. Or if they are diseased, they stay in hospital and are treated in the hospital. So these two pillars, quarantine and isolation, are the most effective public health measures. So this is a purely public health driven response. And in addition then, all these, contact tracing is done properly, that people keep away as much as possible from other people. We call it physical distancing, and that you wear a mask and certain hygienic measures are in place. And obviously the compliance to these different measures is going down. And you can particularly see this if you look at the lockdown, which we had in March. This was highly effective. In between 2 or 3 weeks, the numbers were run down, and we have various indications, mobility indications, for example, which we measure by telephone contacts on aggregated anonymous data. That people really were very compliant, and no compliance is going lost, and you see that we don't get the numbers down. So basically, the communication issue is a huge barrier in a country, in a democratic country. And this is something that is good because we need, of course, an open discussion, but it is tough if it goes to disruption. And the last point I want to make is that we have clear indications that particular parties, but even some particular countries so for other countries are now specifically producing fake news to really also cause devastating responses when it comes to vaccine trust, for example. And so this is a very, very critical moment, as I see it, the most critical moment we have been experienced so far in this pandemic. And with this, I stop here.
Thank you very much. A democratic structure produces multitude of opinions, yes, but what do you think about the scientific situation? So we do have voices from different scientific disciplines, but within the disciplines from different representatives, epidemiologists, virologists, and they do not agree in detail. Sometimes they do not agree in general. I think you, as the president of the Public Health Institute in Germany, you have to manage these very disparate and contradictory research results. Is this a problem?
The main problem here is that for many of the measures that we are doing, not all of them are evidence-based. This is a big problem. Although we're doing already scientific papers, we're publishing papers, various people all over the world are publishing data, but the evidence for the measures is not too strong. Most of them are plausible and based on expert opinion. And as there is not very much evidence, it's hard to tackle these. And that's an obvious problem that we are facing currently. And this will take another half a year or a year at least until we have really strong evidence, because whenever you look at the publications, you see that they are comparing which measures we're taking in each and every country, but nobody so far is comparing as how compliant people were and how compliant societies were to enforce these measures. So this is slippery ground, yeah? And therefore it's absolutely understandable that opinions are different. So I can't really, many of the accusations or different opinions are also not evidence-based, but this is the true problem. If we would have more evidence for many of the tools we are using, it would be much easier for me to obviously discuss and explain the measures we are taking. That's the bottom line of the problem here.
You are on the scientific side. Philippa Whitford is on the political side. So what you do get delivered is a multitude of scientific opinions, and you have to base a political decision on this. This is not possible. How do you handle that?
Well, I think this a little bit comes back to what I was talking about at the beginning of my presentation, which is having more politicians who have a scientific education or a scientific background or a medical background. Because if you have been involved in research, as I was for many years around breast cancer, you understand the language. My own doctorate was in breast cancer immunology, so I could read the papers. I'm not an expert in zoonosis or viruses, but the ability to look at some of the research, to understand that you are getting different voices, and to help you weigh one opinion against another. And obviously that's why you have advisory committees where they try to balance that out and give an overall advice to the politicians. What we have then seen is it's not just deciding what probably needs to happen scientifically, because we know if you wait 6 months, as Lothar is saying, until you have a clear answer, you've already been completely overrun by the pandemic. So, go hard, go early, or the virus will get you. I mean, that's quite simple. So you have to do many things on the basis of what sounds reasonable, what sounds a reasonable hypothesis to tackle it. But what politicians then are having to add into that is the economic and social impacts of closing schools or shutting down restaurants. So it's probably not so much the difference in scientific opinions, because usually the advisory committees will have come out with an overall opinion, although we do get different, there is variety there, but it's adding in those other aspects. And that's where I feel the UK government particularly has tended to go lurch from public health crisis to economic crisis, back to public health crisis, back to economic crisis. And here we are in our third lockdown. I think if we look at the Asian Pacific countries who have done well, they often had experience of SARS back in 2002, 2003. So they didn't waste time arguing whether COVID-19 was real. It was almost like politicians going through the bereavement process that someone who is terminal with cancer, denial, anger, bargaining, we've actually seen all of these stages which have wasted time. Those countries went, yeah, we've been here before. This is what we need to do. Now, some of them obviously actually had either physical infrastructure in place, digital monitoring infrastructure in place, and as you say, probably a more compliant population who are, used to following rules, who accept following rules in a way that maybe our societies find much more uncomfortable. But what we see now is that they're getting the benefit of that. They're not traveling the world, but internally, they have almost normal domestic economies. And, you know, schools are open. Some of them didn't even lock down at all because they were able to trigger that response. And we wasted a lot of time in the spring and yet again in the autumn. That's what I find difficult, is the repetition of mistakes in the autumn in the UK that were made in March. And some of the narrative around the expectation from vaccines that makes me concerned that actually in late spring, the same thing is going to happen again. And, you know, COVID is not just damaging to frail elderly people. We're seeing the fallout from young people affected with long COVID, chronic fatigue, etc. This is something that you really want to avoid this. It's not a minor, you know, 2 days in your bed kind of disease. It can really leave people with long-term sequelae. So we do need to find ways of driving it down in our community while allowing us to have as much normality as possible.
Yeah, and we do have to manage this within a democratic society. This obviously is a problem in this context. Do the two of you have an impression comparing the situation in Germany and in Great Britain? You are familiar a little bit with the situation in just the other country. Lothar Wieler, do you think the interplay between politics and science has another twist in Great Britain than it does have in Germany? And is this in any case related to handling the COVID-19 crisis?
I mean, I'm not too deep into this, yeah. But as Dr. Whitford stated, in the beginning in spring, the reaction, and based on scientific advice in March, was strong and appropriate and successful. And the back down from this was that a huge variety of people in Germany totally misinterpreted this and thought that this disease was actually nothing special. So this is so-called prevention paradoxon. So the strong response led a society to believe that this disease is basically just a minor disease, not recognizing that we stopped it by measures. And there were long discussions in Germany that would argue that this lockdown was unnecessary and the numbers were anyway going down. This proved to be wrong. And I think most of the scientists who really are into this topic were clear with this. And again, what I wanted to say here is it's really a difference. It's a difference in terms of responsibility. I would say that still science has a strong meaning and it has gained importance over this crisis. It has also gained importance when it comes to climate change and so on. I think that the science is on the rise when it comes to perception of scientific outcomes. But what I want to say here is, you can't even say politicians. Clearly in Germany, Chancellor Merkel had a clear vision that we need a strong, early, hard lockdown in autumn. But most of the prime ministers of the federal states didn't share her view, but they all are politicians. And as we are federal states, they basically overrule easily our chancellor. So I think this is something that, so then how could I answer this question? The chancellor fully understood the scientific issue. The others were, at least most of them, didn't take it. So I don't know how the situation in Britain is. I had the feeling that in the beginning, the acceptance of this disease as being as has a strong impact as it has was more shared by scientists than by by political leaders, but this is just an observation from outside. I can't go into this too much. On the other hand, of course, science in Britain is really strong. Scientific quality of Britain, science is strong. So obviously the science as such, I would say it's in both countries, it's a strong scientific community we have.
I would agree with that. I think that, you know, in actual fact, if you go back to the way to fight such a virus, it isn't brand new science. The testing was new, the vaccine is new, but actually the knowledge of, you know, finding cases, testing them, tracing their contacts and isolating all of them with support has been around for, you know, decades, over a century. So that isn't new. And yet on the 11th of March in the UK abandoned testing and contact tracing. They outsourced the testing to a completely new sort of parallel commercial laboratory system that while the person got the result, the public health system didn't get the result. Neither their Allgemeinarzt, their family doctor, or the departments of public health who needed to do the contact tracing. So the UK only really started contact tracing in June, and it was making a difference. But the problem is that, you know, it's been this oscillation. I mean, Scotland genomics shows that we had over 300 strains in the first wave, and we managed to eliminate virtually all of them by last summer. So Scotland got down to what are described elimination levels, as did Northern Ireland. And they approached the UK government to say, why can we not have the common travel area? We are an archipelago of islands. If we control our external borders much more easily than Germany, we should be able to actually carry out that elimination and open up our domestic economy. And unfortunately, by then, the kind of public health response was already changing back to a no, we give people vouchers to go to restaurants. Now it's the economy's turn. And of course, that kicked off the second wave. And so a lot of what you need to do isn't new science. Yes, the tests and vaccines, but the actual management of any epidemic or pandemic is exactly the same. And part of the problem here, as Lothar says, it's not a lack of good scientists here. We have very good institutes and very good scientists, and many of whom have been speaking out for over a year. But it was actually the basics that was being forgotten, that you need to manage the physical distancing, the hand hygiene, the face coverings, but you need to have test, trace, and isolate working. And often that has been the biggest failure in the UK. And that's what we need to do now. That, along with things like ventilation, we've never paid enough attention to indoor air quality. We now accept that COVID is an aerosol, it's present in a room, it's not just droplets, and therefore you actually need to look at how are you changing the air in that room? Do you have decent ventilation? Are you using air purification systems, etc.? So, you know, the vaccine will make a huge difference, but we also need to look at these other infrastructure measures and organizational measures that will help us to keep the cases right down without everyone being stuck in lockdown for months and months and months, as Professor Wieler says, you know, getting fed up and beginning to break the rules as individuals.
And I want to make a point here, Dr. Whitford, exactly what you're saying. There was once a press briefing that said, this is a public health response, yeah? A classical public health response. But you brought it, you really made the point here. It's about processes, setting up processes, optimizing processes, operationalize processes. And I'm very, very confident that there are companies, professional companies, particularly in Germany. We have a very strong car making company, for example, who put together thousands of different pieces brought together from all over the world and make out thousands of different cars. And this is the operationalization. This is when it comes to the bottom of the problem. And I don't think that particular administrations and bureaucrats in countries are the best managers of such things who have to be operationalized. And this is something, absolutely, testing, tracing, this is logistics. And I think this is something that we should learn from it, apart from the fact that we have, of course, to work with all different disciplines, behavioral disciplines and whatsoever, communication, putting things into place and communicating and taking care of the lost ones and so on. But it's most of it, public health is a lot of logistics. And I don't think that countries are the best when it comes to logistics.
I agree with that. I think communication.
A second, Isolde, please, is it already, is the audience already putting questions and answers? Then we should start. Philippa, just one sentence and then we switch over.
It's really just, I think, the importance of communicating things that are very complex in simple language. You know, people need to understand the risk and they need to understand what you're asking them to do, and that you will make it as fair as possible. So I think communication and understanding is really important.
Yeah, absolutely.
Yes, I have sent you some questions in the chat, but I'm happy to kick off the Q&A. Thank you to everyone who has sent us questions. And I would first like to pose a question to both panelists. From Lukas Tohoff from the Leuphana University in Lüneburg. He asks, how democratic can we be in times of crisis? And maybe Dr. Whitford, would you like to answer that first?
Well, I think you can't afford in democratic countries like the United Kingdom and Germany, I don't think you can afford to turn it into a totalitarian state, in that you then very quickly lose cooperation. You simply can't police every action that people are going to take, and therefore you have to convince them. And so the importance of some of the leaders we've seen across the world, the ones who've been more successful as opposed to less successful, I think the kind of briefings that politicians or scientists are doing with the public, how they explain things. So I would not go to a, right, okay, you know, here's all the rules, you're all going in prison if you don't do this. It's a matter of convincing. And often, as Professor Wieler says, we don't always have the absolute evidence for everything, but to be very transparent in explaining why are we asking you to do this, and explain it in a clear language. As a breast cancer surgeon, I spent 33 years explaining breast cancer and its treatments to women so they could make decisions about their treatment. And it's that kind of translating very complex issues into plain language, very straightforward, and for politicians to set a good example. If you have politicians who break the rules themselves, then that undermines the rules. So I still believe you can take a democratic approach to this.
Yeah.
Mm-hmm. Here is another question.
What about...
we just can switch. Go. During the pandemic, the government in Great Britain decided to abolish Public Health England. Is this true? And how do you justify this?
Yeah, don't get me started. Obviously, Public Health England as a body only came into being back in 2012, 2013 through the Health and Social Care Act in England. It is largely the English body. There is Public Health Scotland, which is completely separate, just as the NHS in Scotland is completely separate. They obviously have played a major role in this, but they have now been combined with some semi-commercial organizations to set up a health protection, a national health protection organization. But the concern is that that will be, if you like, learning yesterday's lesson, in that it will be focused on the pandemic. It will be focused on how to prevent future epidemics, but all the other aspects of public health, you know, around housing, around smoking or drinking or drugs or exercise, will be lost from that responsibility. And yet it is often underlying disease, like being obese, being overweight, having heart disease, that has made people most vulnerable to COVID. So it was quite a shocking thing to do in the middle of a pandemic, and that many public health doctors are very concerned that it's now, okay, we've had a pandemic, this is the priority, but we're forgetting the lesson that the reason some communities were so vulnerable is because of the underlying ill health that relates to poverty and deprivation in the first place.
Yeah. It's an equivalent question, Mara Weidemann, to Lothar Wieler. What has cooperation with the German government been like in your eyes? Would you evaluate the current measures as rational? And do you have any ideas for a long-term strategy from the Robert-Koch-Institute perspective?
So first of all, let me say that I won't comment on what happened to Public Health England, but I have to say that I'm glad that I could revise 3 years ago Public Health England, and I was stunned by the fact that this was set up into living 6 years ago, Public Health England, and it's really amazing. You know, most of the public health institutes worldwide have been were founded when infectious diseases were the most important issues, and therefore they are all based in this. Robert-Koch-Institute is exactly like this, and I'm so glad that we're now turning into a public health institute, because the true burden of disease, of course, is not infectious diseases, but it's in all other chronic diseases. And therefore, that's the only comment I want to make here. The long-term strategy is very clear, and it's not funny at all. So vaccinate as soon as possible, because vaccination is the only measure currently we have to control it. And contact reduction, testing, tracing, public health measures with lockdowns are the only way currently we have. There's no other alternative, as long as we don't have therapeutics that can may bring us away from prevention. Public health prevention currently is the only possibility to bring down the numbers, and that's the truth, and that's a fact. I'm absolutely convinced that we don't have. The only other way would be we accept many deaths. We accept that a disease will run over the country, we will have overloaded hospitals, and we accept a huge amount of people dying of this infectious disease. And this is an alternative that never, to my understanding, has never been acceptable.
And this would include, it is the question of Katrin Feigl, this probably will include the wearing of masks in public to avoid a massive...
Yeah, I mean, you know, this is the least intervention, to my understanding. Wearing a mask is really peanuts in comparing to all other measures. Wearing a mask is something that really, and there have been also rumors that people get psychological problems when they wear a mask, and we know from psychological studies that this isn't true. Particular children actually like to wear masks. They do it in their free time oftenly, and so yes, of course, mandatory mask wearing is very efficient.
My idea is to involve children and young people in a contest to design masks, and to really make them part of their appearance, and to make it a very lovable element of being
fashionable. I thought it would be fashionable at one time, and everybody would say, "Oh, I have a nicer mask than you have," and we have competitions. But this is some of the strategies that in Germany were never taken. Yeah, we never. My feeling is that many of the decision makers never really got into this, that we are really facing a huge problem. If they would have, we would have had much more good ideas and innovative, whatever, you know, when it comes to how do you drive to your school, or how do you manage schools? Yeah. There are so many good examples and ideas, but many people never really got into this. So they thought, oh, this disease will go over, and it takes 3 or 4 months and it's over. And that's wrong.
Yeah, that this really would be a truly democratic way of coping with this situation.
They're certainly quite fashionable and varied here. I mean, if you go out, you will see people using their masks to express humor. I mean, there's many funny masks, pretty masks that, you know, match their outfits. So there's certainly a huge variety here. And obviously what does exist within the advisory group to the UK government are the behavioral scientists. And they're actually quite important in this, in how do we keep people on board? How do you keep people involved, motivated? And as you were saying, Professor Wieler, that great sense of camaraderie and communitarian approach in the first wave, you know, how do you get that back? How do you maintain it? How do you get people to take an action, maybe not just for me, but for my neighbor? That's the important thing.
Yeah, and it is an integral part of public health. So public health is not only composed from and not only spoiled from the biomedical sciences, but also from the behavioral side of the sciences, including the economics. Here's another question, Annika Honak. Question to all, especially in the terms of the vaccine response. Do you think that solidarity with the global south is still or should be a priority in the government's decisions?
Well, if I start, as I say, I'm chair of the all-party group at Westminster, and we published a report 2 years ago looking at how we raise our ambition around the vaccination of children in the global south, aiming for the fully immunized child. And as I say, we're working on one on vaccine confidence at the moment. I mean, you know, many countries are talking about the actions they take to protect their borders. And the problem is, you know, 14% of the world's population has bought up 83% of the world's vaccines. That means many countries will not get any access to a vaccine until wealthy countries have vaccinated their entire population, which could actually be in the early autumn. And so in those countries, the cases will go on spiraling, and the more spread you have, the more replication, the more mutation, until we don't just have a South African and Brazilian variant, we'll have other variations. And some of these variants, like the South African, will not be defended by the vaccine. And that would undermine everything that we've done. So we should again see that it is in our own interest to actually work together as the international community and take a more global approach to a global crisis. And as I say, there were many warm words and grand sentences last year, even, you know, money that was put into Gavi, that was put into COVAX, but yet they're not able to access sufficient quantities of the vaccine at the moment. And I think that we see obviously the friction between the UK and the EU at the moment over access to the AstraZeneca vaccine, but we're also seeing that on a global scale. And I find it really disappointing that for all the talk, we are failing to take a global approach to this global crisis.
Nothing to add. Absolutely. I 100% agree with what Dr. Whitford said. Yeah. Very, very sad development.
No, we have some 5 more minutes, so please take the opportunity. I just have a question. Lothar Wieler, you have 3 wishes. The corona crisis is gone, let's hope within 1 year or so, or at a lower threshold. What are your wishes for your institute? What would you ask the government for? Are there any structural changes, any scaling changes for your institute? what do you think is really urgent when all this is on another level of coping?
Well, I would hope that the importance of public health is appreciated. And so basically there are various tools and surveys and monitoring tools and behavioral studies and whatsoever, so that you reach particular groups in your society which are always, in each and every crisis, are losing because they are left behind. And so in this particular area, I'd like the Robert-Koch-Institute to be much better resourced. And this is something that we're needing since years. And I hope that politicians understand that public health, routine, the groundwork of public health, this is what keeps a country together. This is what keeps societies together. And I have been advocating for this. This is one of the reasons why actually I applied for this position 7 years ago. We put billions into biomedical research, and this is good, and this is fine. But we put only a very, very small amount into basics that would make a huge change. I mean, you're putting now billions into the economy to keep the economy running, but we don't put enough in prevention. We don't put enough in people, smoking or being obese. This has to change, and this is a huge problem. And what has been told by Dr. Whitford, what's happening with Public Health England is just the opposite of what should happen. And I hope that in Germany, people will understand that public health is at the key of all of it. And it's an all-over government and all-over society approach for better living in a better society.
Mm-hmm. And Philippa Whitford, once you hopefully will be the State Secretary of Health after Corona is on a lower level, what are your visions? What would you prefer to set as political aims?
Well, I don't aim so high as to be Health Secretary of the UK. As an SNP politician, I'd be quite happy if I could get Scotland into a better state. But it builds on what Professor Wieler says is, I'm very conscious that if you say the word health in the United Kingdom, and probably in all countries, people think of a health system. Here, particularly, people think of the NHS. And what I often say is the proper name here would be the National Illness Service, because that's actually what it does. It catches people when they fall, it helps them manage illness, but as Professor Wieler says, it's not preventing illness. Health, in the sense of health and well-being, the physical, mental, social, and environmental well-being of people actually comes much earlier in life. Was your mother healthy? Do you live in a warm, dry home? Do you have enough to eat? Is the air where you live clean or polluted? Can you walk and cycle to school, or is it unsafe? These are the things, and we need to switch our effort from seeing it as illness management to the real building of well-being. Now, we all know we need to be in a different economy by 2030, or simply we won't have a planet to live on anyway. But it's very difficult to change a speeding train in the middle of the journey. The one thing COVID has given us is it has stopped everything. It has stopped our economies, stopped our societies. So we all have an opportunity to think, what kind of society and economy are we going to invest in and rebuild? And therefore we have the chance to build well-being economies, to build sustainable circular economies, to tackle climate change. And if we don't take that opportunity, if we just go back to what we had, inequality, the elites having all the power and wealth, children not reaching their potential because they're stranded in deprived and poor communities, then we will have missed that opportunity, and we will not protect our planet, and we will not protect the people who live on it.
You should run for Prime Minister, not only for Secretary of Health.
I couldn't be bothered. I couldn't be bothered.
Thank you, Philippa. Thank you, Lothar. And Isolde, you want to say goodbye to us?
Yes. Thank you, Dr. Whitford and Professor Wieler, for this interesting and insightful discussion. And thank you, Professor Horemann, for facilitating it in such an engaging manner. The LSE German Society expresses its gratitude to all of you for taking the time. And to our audience, thank you for your interest and attention, as well as the challenging questions that were posed in the Q&A section. And to all of you, I would again like to express our apologies for the difficult start, but I'm pleased that so many people could first join on Facebook and then later came over to Zoom for this conversation, which is so crucial to have in these difficult times. We are concluding the first day of our symposium and are looking forward to the next 4 days and seeing many of you at our upcoming events. Thank you all so much and have a good evening. Thank you.
Bye-bye.
Take
Bye.
care. Bye-bye.
Take care. Stay healthy.
All of you, indeed.